After my heart attack, the doctors at UMC encouraged me to take a good look at my health and to start working out at the cardio rehab.
Cardiac rehab is important to the health of the community because it acts as secondary prevention for patients with heart disease. It helps patients stay out of the hospital longer. It helps them live a longer and healthier life. It gives them the confidence that they need to live a better lifestyle. UMC's cardiac rehab is unique because we're one of the only teams that consists of all exercise physiologists and a respiratory therapist. We combine both cardiac and pulmonary rehab, which is an advantage to UMC because oftentimes heart patients also have lung issues, and so we're able to treat both of these populations. Our team works closely with our cardiologists and our advanced heart failure team to work with LVAD patients, which is a population of patients with end-stage heart failure who require an implant device to help them sustain life longer. And so we're the only rehab that's able to work with these patients and educate from a rehabilitation standpoint. Our cardiac rehab is the only program that provides inpatient rehabilitation, or also known as Phase 1. So what we do is we start at bedside. Patients don't just come to the outpatient clinic. When they come in with an acute event or they're coming in and out of the hospital with frequent readmissions, we try to see every single patient and start education and early mobilization to prevent them from coming back to the hospital.
My first day at rehab, Brittany came up and started working with me and going through a plan and a way to progress through the rehab for the heart attack. And our goal was to get me back on the stage with Lubbock Symphony.
And it was very important for him to be able to do this with confidence, without pain, without shortness of breath. So by attending the cardiac rehab, it was able to help build his endurance and give him the confidence that he needed to get back to that.
I had not worked out in years, and I had certainly not worked out with my arms as I should have, and that was a new approach for me. The bass is my instrument, and that's where I focus on it. It's not an easy instrument to play because you have to have a pretty good amount of strength in your hands and your back and your arms. So it's a matter of just making sure that you can have the stamina to do that, and the stamina would be for a whole concert or a whole rehearsal. And that's something that takes training, and it also takes physical activity.
And so we were able to adapt a lot of our exercises to allow him to be able to perform what he wanted to do.
We made our way to increasing my stamina, increasing my breathing, and working out the heart as healthy as I could. And we decided that the best thing for me to do would be come up there, get into a room and do all the motions I would be doing, and we would see if I could survive it. And as it worked out, by that time I was not healed, but I was certainly well on the way of being able to do that. And the concert came off very well.